This case highlights an example of middle lobe syndrome. It refers to a chronic collapse of the middle lobe and can form variable radiographic patterns depending on the type and the way the middle lobe collapses. In this particular example, we can see the right heart body, but in some instances of middle lobe syndrome, the right heart body is obscured. If you look on a lateral projection, there's a greater than expected linear density in this direction. Now we're going to look at a CT scan of the same patient to see and evaluate how the middle lobe collapses. In this particular case, the way the middle lobe has collapsed is more towards the periphery of the lung, and that is due to the orientation of the other two lobes. You can follow quite easily the right oblique fissure as well as the horizontal fissure, and this triangular area is what used to be an expanded middle lobe. The exact pathophysiology of middle lobe collapse is variable and can often be described into obstructive or non-obstructive causes. In obstructive causes, there's usually a problem in here where there's an extrinsic or intrinsic lesion blocking the entry of the patency of the bronchi. In this particular case, it is a non-obstructive type. The exact pathophysiology of this is not very clear, and some papers illustrate that the unique conditions of the middle lobe predisposing to the situation. For example, the middle lobe has a narrower bronchus going into that area, and also the collateral ventilation can have high resistance as a result of a lower non-pleural to pleural surface area. The importance in assessing a middle lobe syndrome is to look at any bronchiectasis extending into this segment, and also to look at any associated endobronchial lesion. We're going to look at the coronal image, where the orientation of collapse is better demonstrated in this orientation here, but this doesn't always happen to be the case, and it depends on the orientation of the other lobes. In sagittal imaging, it becomes much clearer, and in this particular case, the middle lobe has collapsed downwards and is like a flat band occupying this portion. References containing important links have been attached below.